Good afternoon again. My name is Amal Nirgurkar. I'm the CEO of Patient Prism. And I'm here yet again with Dr. John Meis. Every single week, we have Dr. John on our podcast or our webinar to talk about many things in dentistry that we should be doing right now as we navigate this crisis. And as if you've not seen this before, Dr. John is an international speaker, a two-time best-selling author on Amazon, has run one of the top 20 DSOs in the country, and now advises dental practices and groups through two of his companies, which one of them is Spark Dental Network, that helps small to medium-sized dental groups kind of create sustainable growth, and the Team Training Institute, which helps practices improve productivity, profitability, and achieve peace of mind. And peace of mind is something that we all desperately seek today. Dr. John, welcome again to the show.
Amal, it's always great to be with you, and peace of mind is certainly it's been rationed at this point in time, as has profitability. So it's a fascinating time that we live in, and thank you so much for inviting me to discuss what's current.
Absolutely, and we've gone through a lot in the last few weeks together as well as independently on what practices are doing, what they should be doing now, and you've given us some great advice on reducing expenses, increasing your revenue cycle stuff. But there comes a point where we obviously have to plan of when the economy does start and when the restrictions go down, and many states are thinking about removing those stay-at-home orders. We need to plan to restart our practices. And when I asked you about this last week, you said we are absolutely have been working on the comeback strategy for since it started, since the epidemic started, and we've come up with a concept of a 100-day plan. Mm-hmm. And I was immediately excited about having you again to talk about that. So tell us a little bit about what you've been thinking about. You've put a lot of resources from your organization to craft the strategy called the 100-day plan for people to come back and restart their practices and their lives and get people back and start seeing patients again.
Yeah. So it's a fascinating time, Amal, because what we're seeing in the virus, and it's spread across the country, all of the social distancing things has certainly slowed down the spread. Remember, that strategy is not to keep people from getting it. It's to slow down people getting it so that we don't overwhelm the healthcare system. And in the vast majority of the country, the healthcare system, even with the most exaggerated projections, are going to be fine. There are certain areas that have been overwhelmed and areas that will be overwhelmed. But for most of the country, that's not the case. The American Dental Association has given guidance to April 30th that we only do urgent or emergency care. I think that April 30th date and what things look like after the 30th is really up in the air right now. So I think some of the questions are we going to continue with emergency and only urgent care for a longer period of time? I think that's likely. I think they're still trying to determine what the appropriate level of personal protective equipment is and the engineering standards in our offices in order to keep our patients and our teams safe. Those are still evolving. OSHA came out with a report I learned of it late last night, and it gives some guidance. The CDC has guidance, and the ADA has given some guidance as well. So there's stuff out there. Some of it I'm not sure how realistic it is or how practical it is, but there's stuff out there that you can start creating your own guidelines. And I think that's one of the things that we can do is right now we have somewhat of a lump of clay in what our safety procedures are going to be. And I think it's time to start forming that. So that's one of the things in the 100-day plan, is start to form your plan. And as these regulatory agencies have suggestions, um, that will help us as we're formulating our plan for our offices. So it would be so nice to have clear cut, here's what it is, here's what you need to do, and here's where you get the stuff that you need to do. That would be so nice, but we're not there. And so, but I don't think that that should paralyze us. I think we should continue to start forming our own guidelines and adjust them as more information comes forward from all of these agencies that are giving recommendations. Does that make sense?
Yeah. So with respect to the 100-day plan, are you creating like a framework for dental offices, at least your clients, to say, here's the framework, and as we learn more, we're going to fit the pieces of the puzzle inside that framework?
That's
Uh,
exactly right.
there's a scheduling framework. There's a scheduling is going to be the big part of the framework anyway.
Yeah.
But all the different components. There's a marketing framework, and teledentistry. There are all these components. And
Yeah.
is that what the plan is doing?
Yeah, that's exactly right. So we will have our 100-day checklist. That should be available Friday. And you'll be able to find that at the teamtraininginstitute.com.
Okay.
And so that will be, kind of the starter of people getting their heads in the right place to open. I don't think opening for regular business, I think April 30th is not a realistic date. May 31st, maybe June 30th, maybe, but I think April 30th is too soon. In most places, the virus is certainly going down. There are hot spots where it's going up, but for most of the country, it's going down. And so we're on the right track in a lot of ways. But, if we are, and I know our whole profession is very concerned about the safety for our patients, for our teams. And so I think that our profession will be on the side of caution. And so it's going to be a little while yet, but you can start moving forward. So you can start formulating your plan. You can start communicating with your patients and your teams.
Right.
So, one of the things that that we all have to prepare for is the fact that our teams have been frightened like the general population.
Right.
And a lot of that has been intentional in order to try to get people to socially distance themselves, right? And that's a tall order. And so to get people to do that, the experts have had to, really use a lot of scary stuff, which maybe isn't entirely representative of what's actually happening. But they have done very well in getting people to socially distance, and so we're seeing the benefit in that, in the slowdown of the contagion.
Absolutely. I mean, we saw the protests in Michigan yesterday. Because I know people are getting frustrated, obviously,
Yep.
but if the government doesn't, put the scare in our minds that, hey, this is dangerous, and the moment we start going out, it could spread again.
Yeah.
So during this 100-day plan, what are we looking at? I mean, are you looking at any metrics right now for the offices, or are we putting some metrics in place once we start back, so that we know we're on the right track?
Yeah. So here's what I'm seeing. I'm seeing that patients are not fearful of dental offices.
Oh,
so
good.
If we think back to when HIV came out and AIDS came out, and there was very little known about the disease, and everybody was scared about everything. And then we had this dentist and the dental patient who there was a transmission between the two. There was a lot of fear of dental practices at that time. I don't see that happening now. And so what I see is that, this whole length of time as you're reappointing people out in the future, I see hygiene schedules being very full, and I see patients calling, wanting to get in. And so in 3 of our 4 offices, we have someone answering the phone, full time, and we're getting calls and people wanting to have regular treatment. And so I think that on the hygiene side, things are going to take off, really quite quickly. So so a lot of people have talked about the ramp up. I think as far as busyness, our practices are going to be in pretty good shape. Now, I think that patients are going to be more insurance driven than ever. Remember, 17 million people have filed for unemployment. right? And so if you extrapolate that out, there's probably more than that that will file as companies fail. So it's going to be more than that. And if you think 2 or 3 people per family, that's maybe 50, 60 million people are on unemployment and lower income than they're used to having. And there's 330 million people in the country, so 20% of the country is struggling. And so that's going to affect our practices. So, but the thing to remember and the thing to help our teams understand is that 80% of the country really has cruised along financially just the same. And so if we treat everyone like they're the 20%, then we're making an error in judgment. And if we treat the 20% like the 80%, we're making. So we have to be more sensitive. We have to be better listeners. We have to ask better questions in order to understand where our patients are. So that's one of the things that people can do to prepare is how are we going to talk about finances with people when some people are just fine and other people are struggling?
So part of understanding, you probably need to understand how insurance is part of your practice, right? Because obviously if it was a huge part of your practice and a lot of people who have actually, and so maybe a segmentation of your customers by insurance and understanding that that revenue stream might not be there because people don't have that is something that you probably need to look at, right?
Yeah, right. So now people that are laid off, they have lost their benefits. And so many people that we think have insurance don't have insurance. And we just have to be able to ask questions and just be accepting of where they are. And I think if we get good with our languaging, if we get good at how we talk to patients, if we get good with our compassion and empathy, that we'll sail through this, relatively good. But you can certainly blow it, can't you? If you have the wrong discussion with the wrong person at the wrong time, it could be really damaging to your reputation and to your referrals.
I mean, part of your plan for reopening, is there room for a communication strategy within that as well? Is that?
Oh, there absolutely has to be. You have to be able to communicate to your patients. You have to be able to communicate to your teams. I saw a Facebook video that a dentist put out, and it was really well done. And I can give you the formula because I watched it 3 times and I figured out exactly what he did. And what he did was he set a date at which he said that we're going to be emergency care only until this date. Now, that date, he's going to have to change it, I believe, but at least he gave people some guidance. And he said, I don't know that this date will be stick, but this is what we're shooting for right now. Then he described the universal precautions that we've used for infection control all along, right? So he went into detail about that so people understood what's already being done. And then he walked people through what changes that they were going to make. Now those changes may change, right? So, but he was at least giving people guidance and giving people comfort that he's thinking about their safety. They're making plans, they're making changes in order to make it better. And I think that was really, really well done. And then, he ended with I sure care about you. I can't wait to see you all. We'll get through this together, kind of, languaging to give people some comfort. And, a dentist is a place that's a normal life thing, and so a normal life thing, people hear that person say, we'll get through this and we'll see you soon, I think is comforting to people who, I think most people are having moments where they're struggling with, gosh, how long is this thing going to last and how bad is it going to get? And I think having that comforting voice is helpful. It's what leaders do.
Part of what you had said about the plan, at least, is that you need a plan and it may change and you may need to tweak it as you go along, depending on the scenarios that you've mapped out. So just because you have a plan that is there today doesn't mean that's going to be there next week, because you may have some tweaks based on what really happens.
Yeah. I went backpacking one time and it was a big group of us and we had a guide and the guide was giving us directions and he said, if you run into a bear, here's what you do. Yeah. And the very first thing was don't run. And I think a lot of practice owners and leaders have done the equivalent of run, and that is they've stayed silent. and they haven't communicated with their teams. They haven't communicated with their patients. And so now patients and the teams they have unknowns, right? And unknowns create anxiety for us. And so having a plan, communicating that plan, communicating the fact that the plan will almost certainly change and evolve over time, I think is comforting to people.
You know, nobody really knows the direction at which this is going, but I think the practices that are in my talks with everybody around the country has been the practices that have kind of followed what you're saying here is plan and prepare for the worst, but plan for the best, right? I mean, whatever that means. But you need a plan because again, we know that patients still need your services, and if wrestling apparently has become essential service in Florida, which is
yes, yes.
And and sometimes politics comes in the way of what becomes essential.
Yeah.
But then
so we're going to wrestle our patients into the chair, and I think it'll work out. I think it'll.
That's right. That's right. But at the end of the day, I think as a society, we're gonna figure out that dentistry is going to be an essential component of our society, and it's an essential service. And I think hopefully solutions are going to come around that allow patients to visit their dentist in a safe environment,
Yeah.
and for dentists and team members to not feel scared about being there.
Yeah. Yep. That's right. And that time will come. That time is often a distance, some ways, but more clarity will come as more is learned about the virus. And we don't know what could happen tomorrow. Amal, we talk at least once a week, and every time we talk, there's something new, there's something different. Absolutely. And it's possible that they will find an existing medication that will reduce the seriousness for those people who get the more serious form of the disease. It may be that they find something that already exists, right? So the picture could change really quite rapidly. And if that happens, it'll be fascinating to watch what happens across the country. But beyond that, if that doesn't happen, we will over time learn the best way to manage this, and again, keep the virus from spreading too fast. We can't stop it from spreading. It's going to spread. Most likely we'll all, or a large percentage of us will get it. And most of us won't even know we have it.
Right. Well, if people want to get a hold of you in terms of getting the hands on the 100-day plan, we're going to leave some information on the screen here. Teamtraininginstitute.com. We'll leave both your contact information for team training as well as Spark. I definitely recommend, whether you are a single dental practice or whether you're a group practice, trying to navigate these times. And it gets overwhelming. It gets overwhelming for me every day to think about planning for my business, because there's so many unknowns. And you're good at planning when you kind of can model out the future. But go to Dr. John's Facebook pages, the Team Training Institute. They still have 2 days a week, I believe.
Monday, Wednesday, Fridays at 4 p.m. Eastern time. We do an update. We cover one element of a 100-day plan.
Wonderful.
We'll talk about the virus and what the data is showing is happening, which has diverged a little bit from what you hear in the media and hear from the officials. So it's good to know what's really happening, what the data shows us is really happening. And then we also talk about any regulatory, any recommendations that have been made, and we also talk about any legislation. So as we know, the PPP loan money ran out yesterday.
Right.
And so we'll be reporting on what that means. We're reporting on what's happening in Congress. Are they going to approve more funds for that, which I think is likely, but it's going to take some time as they all try to get their pet projects in.
Right.
And so, but I think that will happen, but we'll be reporting on what's happening, what progress is being made. That way you have one spot where you can go and get just kind of a snapshot. They're very quick, usually 15 minutes the one place where you can get a snapshot to know what's going on and have at least one idea how to move forward with what you can do right now.
Fantastic. I think I've been following you on those channels every day, and although we talk every day, you have something interesting to say and share every few days. So please go to the subscribe to his channel over there on Facebook, and then we'll come up with another topic next week that might be interesting.
Yeah.
Thank you so much for coming again and sharing your wisdom. And I look forward to continuing these discussions with you in the future.
Yeah. Amal, it's always great to be with you. I'm so appreciative of you, your clients, and your great team that put these things together. They do an amazing job. So thank you so much, Amal. We'll talk soon.